It's been 2 weeks since the hospital for sick children was the target of a ransomware attack. And not only are SickKids staff still dealing with the effects of that, 2 websites affiliated with the hospital have just had to be pulled down.
This is a particularly bad one for the fact that it attacks primarily virtual machines.
Cybersecurity expert Robert Falzon is not sugarcoating the current situation SickKids is facing.
When you're attacking the platform itself, you take down a number of pieces of infrastructure at the same time. So this is why I think it was so dramatic in such a short period of time.
It was on December 18th when the pediatric hospital issued what's called a code gray. Several internal phone lines and web pages went down, and clinical teams ran into delays accessing patient lab and imaging results. But urgent care and medical appointments carried on. At the time, hospital staff said a ransomware attack was to blame, adding it would be weeks before things got back to normal. Police officers are continuing a probe into the attack. Late Friday, 2 sites operated by SickKids were taken down due to, quote, potential unusual activity. Staff said it's not likely connected to the initial attack. We asked SickKids officials for an on-camera interview, however, they were unavailable. But there's potentially good news. According to a statement, as of Sunday, 60% of the systems affected have been restored. Officials added work is ongoing and money hasn't been paid. SickKids staff said they're aware of online claims from a ransomware group that's offering a free decryptor to restore its systems, and they're speaking with experts about the offer and whether it will help.
I don't think there's any honor among thieves. They do, in fact, attack hospitals. They attack critical infrastructure. It's not surprising to me that it's taking so long to restore. These are complex systems. They are in critical infrastructure.
Falzon said with cyber threats facing the world and an increasing shift to digital operations at Ontario's hospitals,
more needs to be done, but I think it's not just a technology problem. It also, we have to look at how we're managing the problem overall.
Adding IT professionals need the resources and power to make changes, especially with soaring demand for patient data.
Paying a lot of money for it on the underground markets and so forth. This is a significant problem with many tendrils to it.
Something important to add here, though. So far, there's been no evidence that personal health information has been accessed. In Toronto, Westoll, City News.